Okay, so now we're going to do 2 weight-based doses of ketamine, and this is going to be, we're going to give ketamine for pain. And so we already have our 130-pound patient. We're going to work with 60 kilograms, which we calculated in the last video. And we're going to use do this with 2 concentrations of ketamine. So our dose locally, if we're going to give ketamine for pain, is 0.25 milligrams per kilogram. And our patient weighs 60 kilograms. So first thing we're going to do is take our dose, and we're going to multiply that by 60 kilograms, and that is going to give us 15 milligrams. Desired dose 15 milligrams, a lot less than the dose that we're going to be giving for sedation. And so to do that, now we have our desired dose, 15 milligrams. And let's open our drug bag and see what the last shift stocked from which hospital. And we have ketamine is 500 milligrams in 10 milliliters, or 50 micrograms per milliliter. So we're going to work with the 500 milligrams in 10 milliliters concentration. Our desired dose, 15 milligrams. Dose on hand is 500. And our volume is 10 milliliters. And so we're going to cross out these. So we're left with milliliters. 1500, 15 divided by 500 is 0.03 times 10 equals 0.3. 0.3 milliliters. So we're going to take this 10 milliliter vial, and we're only going to give 0.3 milliliters. So draw that much. So 0.3 milliliters. So go back. So it's the next day. We're going to give the same size patient our 15 milligram dose. This is all the same. So our desired dose, 15 milligrams. Our dose on hand, we pull out another station here and we get this volume of ketamine. So 500 milligrams and 5 milliliters. Oh, okay. So 15 milligrams divided by 500 is still 0.03. So 15 milligrams, 500 milligrams times the volume. Well, now it's 5 milliliters. So we're going to get the same 0.03. These cancel out, these cancel out. 0.03 times 5. And that equals 0.15 milliliters. So this is this is a really tiny amount of fluid coming out of a small vial. That's only 0.15 That's all we're going to be giving out of this big vial if we're giving this for pain, at least in my area, a little more. 0.15, that's all we're gonna give. And that's, you might be watching this and you're drawing this up, heat of the moment, and that can't be right. That's why the cross-check is so important, and practicing is so important, and really looking through your equipment at the beginning of shift and knowing what you have is so important. So we're only going to give 0.15 milliliters.